Okay, it's a from Tom's desk. This one's on healthcare. I'm back in the States after 20 years and I'm trying to get things sorted out and all that and looking for information I want to get or I need to get sometime in the near future. Some cataracts taken care of. And okay, VA, I can possibly get it, but waits are long and the whole process, from what I've been able to find out, has been somewhat problematic. And then Medicare is trying to charge me 20% extra per month forever because I didn't sign up when I was 65 living in Thailand. Well, when I was 60, turned 65 living in Thailand, I was notified that since it's not available, I didn't have to sign up, and I wasn't told about any penalties. Okay, I'm in the process of uh, appealing that whole thing. Then, on top of all that, one has to figure out, do you want what they call Advantage or PPO or whatever in doctors? Well, my doctor, who, I see maybe once a year, is through VA. I get my meds through VA and all that kind of stuff. And whatever, it is what it is. Now, trying to figure out how much it's going to cost for glasses. Well, according to what I've given to understand and figured out, Medicare covers about 80% of costs. So what people do is they get these Advantage or add-on things. Now these add-on things cost, from what I've been able to find, between $188 and $250 a month, which means your basic insurance cost is going on the better part of $450 to $500 a month. That's insurance, and that's just for me. Now I'm talking about. And it's screwy. Now, a friend of mine, Henry, who I've known forever, he's had a couple strokes in his legs and, medical problems and all that. Well, now he's getting a knee. None of this has cost him a cent in the United Kingdom. It hasn't cost him a penny. And with his knee surgery coming up, they've been into his house, they've fitted it with stuff he's going to need because he's going to be, impaired for a period of time while he's getting healed and all that. If he needs food delivered, they deliver food. If he needs things done, they do for free. Now, having lived in England for a while and familiar with Canada and one thing and another, I've never heard anybody talking about having a problem getting these procedures done, regardless of age. I've not heard anything about lengthy waiting lists and all sorts of problems. Whereas here, if you've got like these things called Humana and all this, these Advantage plans, your doctor has to give you permission to get a procedure if you want a procedure. Then he tells you who. The other thing in the United States is, from what I've seen, and let me use electric wheelchairs as an example. I see people scooting around on these things everywhere. In America, people abuse the system. They've got these free phones, they've got electric wheelchairs, they've got all of these things because Social Security provides these. And Social Security disability. Social Security disability is a scam in the United States. There's lawyers that make sure people who don't deserve it and don't deserve it, get Social Security disability. It takes millions, if not billions, out of the money available for people. Whereas in the UK and Canada, as far as I'm familiar with, people don't abuse the system like they do here in the States. And people aren't, I don't know, it's just one of those things that I've found about being back in the States. The other thing is, doctors in the States. I mean, back years ago when I was in Ireland, doctors, their school was paid for, and they weren't wealthy people and they didn't have to make, hundreds of thousands of dollars back to pay for their education. But here in America, if you're a doctor and you get out of school with $500,000 in debt, you have to be making, money. The second part is this is a very litigious society. And insurance for doctors is very, very high. So all of these things make it really goofy. But at the end of the day, the bottom line here is, in the United States, healthcare is a business. Education is a business. Until all of these things are put in some sort of perspective, it's going to be a screwed up situation. But, I look at England, I know people there, I know people in Canada that have had procedures done, no problem, no waiting, nothing, and I mean, healthcare in the United States is screwed up, as is education and a few other things. But that's my opinion on healthcare from the United States for this weekend. And I haven't even mentioned Thailand. So, y'all take care. Have a good week. Spring is just around the corner, somebody told me. So, y'all take care. Bye.